Hi, my name is Dr. Robert Horth. I'm a cardiologist with Froedtert and the Medical College of Wisconsin. I received my medical degree from the University of Pittsburgh School of Medicine. I did my internal medicine residency at the University of Pittsburgh Medical Center, and I did my cardiology fellowship at the University of Miami in Miami, Florida. I am board certified in internal medicine, cardiology, nuclear cardiology, echocardiography, and cardiovascular computed tomography. As an adult cardiologist, we see patients 18 years and older. My specialty in cardiology has been in non-invasive imaging. I have been trained in echocardiography, nuclear cardiology, cardiac computed tomography, and cardiac MRI. When I was in training, I always thought that the future of cardiology would be in a non-invasive manner where we can obtain as much information as we can without having to do invasive procedures. I think as somebody who's trained in all of these imaging modalities, it helps me know the benefits and advantages to a certain type of testing that may hopefully help in making diagnosis and improving outcome. My practice philosophy, I would say, is the mainstay is in communication and compassion. I think communicating with patients, I think, is very important. I would hope that patients have an understanding of why we are doing certain types of testing or why we are taking certain types of medication and how that can impact their health moving forward. Hopefully that can be delivered in a compassionate way. I think in this day and age, it's certainly very important that the patient-doctor relationship remains strong. And I think even in the computer age, I think it's probably one of the most important parts of the practice. One of the most rewarding things about my being a cardiologist is hopefully impacting the quality of patients' lives. I have found over the last 20 years of practicing medicine that the relationships that I forge with the patients has been very rewarding. Knowing that we can diagnose a problem and hopefully solve that problem or ameliorate that problem, I think is very fulfilling. Cardiovascular disease is the #1 cause of death in the United States. I feel as a cardiologist on the front lines that hopefully I can impact the quality of patients' lives and how long that they live. I think that we have treatment options, and the knowledge base in cardiology is expanding very, very quickly. There are a lot of things that I do in practice today that weren't in existence when I finished training, and you really have to stay on your toes to stay up to date so that you can offer the most advanced technologies and treatments for your patients.